David, how does healthcare affect our fiscal challenges?
Healthcare programs are the single largest challenge in our overall fiscal problem. They're driven not just by demographics, but the fact that healthcare costs grow faster than inflation and faster than the economy when the economy is growing.
This chart shows healthcare spending in other countries compared to the U.S. Why the difference?
We spend 2.5 times per person what other major industrialized nations spend, and we get below average societal results on things like life expectancy, infant mortality, medical error rates, because we don't have the right incentives, transparency, and accountability mechanisms. We need to have those aligned in order to generate value for money. Throwing more money at the problem is not the answer.
So how would the Affordable Care Act impact the deficit, and shouldn't we strive for universal health care in America?
There's absolutely no question that we ought to have universal health coverage in America, but it needs to be appropriate, affordable, and sustainable. Government has way overpromised on health care. For example, while the politicians told us that the Affordable Care Act was going to reduce deficits, the chief actuary of Medicare estimates that it will cost $10 trillion more than the politicians claimed. Obviously, that's a big difference. So what we need to do is determine what level of coverage does everybody need versus the unlimited amount of coverage that they would want to have. I would respectfully suggest we definitely need preventative and wellness, and we need protection from a catastrophic illness or accident. That's a basic need. The government's always going to do more for the poor, it's always going to do more for the disabled, it's always going to do more for veterans. But we can't promise everything to everybody.
What about the financial condition of Medicare? A lot of people count on it.
Medicare is in very poor financial condition. If you look at its 3 programs, based upon reasonable assumptions, it's estimated to be underfunded $37 trillion. That's the difference between what revenues it's expected to have in the next 75 years and how much in benefit payments it's expected to have to make. One of the reasons that's the case is because of demographics, the fact that we've gone from 16 people working for every person retired down to 3.2 to 1, going down to 2 to 1 by 2030 to 2035, and the fact that 95% of people who voluntarily sign up for Medicare's voluntary programs get a 75% taxpayer subsidy for their premium, irrespective of their income and wealth. That doesn't make any sense. We should have universal opportunity, but subsidies should vary based upon your means.
So David, what reforms would you recommend for Medicare and for health care in general?
We have to recognize that we're the only major industrialized nation that doesn't have a budget for health care. You can't write a blank check on health care. It'll bankrupt you. We have to pay more for outcomes rather than activities. We have to look at our transparency with regard to cost and quality to get market forces working more. In addition, we have to look at our tax preferences that we're providing for health care. And we have to deal with some very difficult issues like end-of-life care, which frankly happens due to a variety of circumstances and at very different ages.
Should anything be done to reform Medicaid for the poor?
We need to have a universal definition of what poverty is in this country. We need to make sure that there's a certain level of coverage that's provided based upon that definition. We need to provide states more flexibility to cover larger segments of the population and or provide more generous benefits than the minimum standard. At the same point in time, the federal government should consider providing a certain amount of funds through a block grant to the states to discharge its commitment, recognizing that the amount of those funds will vary depending upon what the poverty level is, depending on the state of the economy, and a variety of other factors.
What about tax deductions and tax preferences to help on the revenue side?
The single largest tax preference in the Internal Revenue Code is the fact that individuals that get employer-provided and paid health care don't pay income tax or payroll tax on the value of their coverage. It's hundreds of billions of dollars a year. That needs to be phased out.